tested using the knockout mice, as I showed you before, progresses somehow. So many of these, for instance, in models of infection, is known that they can be, NKT cells can be protective in many of these models of infection, and this can be tested in mice and can be tested using the knockout mice, as I showed you before. As well, in some other cases, they seem to play a deleterious role, and this is, for instance, in things like in obesity or in IBD. In this kind of diseases, it seems to be the case that when NKT cells are activated, they can actually be deleterious and make the disease worse. Okay, so just a couple of examples about this. So one of the cases in which NKT cells are known to be protective is Lyme disease. So this is a disease that is caused by Borrelia. So if you remember, as I told you before, Borrelia has lipids that can activate NKT cells. And this is transmitted by these tick bites, thingy, these things. So these bugs are infected by the bacteria, and then when they bite, basically they pass the bacteria to us. And what happens in this case, it seems that the bacteria kind of tend to accumulate in the joints, and it induces kind of arthritis-like disease. It's quite nasty, actually. And I think it's particularly, it's a bit difficult to kind of identify, because people have kind of a bit of weird symptoms that are not, it takes a while to kind of understand what they have is actually this infection. And the reason why we know that NKT cells are protective in this model is because when we infect mice with Borrelia, and we infect mice that don't have NKT cells, these are these guys here. So you see that, so this is basically just to show, as I said, the bacteria accumulates in the joints and generates arthritis-like inflammation. So basically, when we have mice that don't have NKT cells, they get more inflammation. So basically, this means that NKT cells are protective and are somehow reducing the bacteria burden and the inflammatory process. Actually, works the other way around, in which NKT cells can be deleterious, is in the generation of fungal-induced asthma. So I'm sure that you've heard before about Aspergillus. So this is a fungus that is quite present kind of everywhere, and it's pretty well known that it can be involved in the induction of allergic asthma. So what has been recently shown is that Aspergillus actually have some lipids that can induce NKT cell activation. And because, as I said, NKT cells, when they get activated, they can produce loads of cytokines. When this happens in the lung, NKT cells produce a lot of cytokines, and this contributes to the development of asthma. So in this case, actually, NKT cells seem to function in a detrimental way, a deleterious way. So basically, their activation makes asthma worse, let's say. One last one is related with the development, or with, I don't know if development is the word, but it has been shown, for instance, because this one is here, is in mice. So mice seem to have, and humans as well, seem to have a lot of NKT cells in their belly fat. And actually, mice that don't have NKT cells, so this, if you remember, are the two models, CD1 knockout and GR15 knockout, so both of them seem to be fatter than wild-type mice. And this has actually percentage of NKT cells in the blood of obese people, that they either go, that they are going to go like stomach surgery to make the stomach smaller. So basically, when these people start to lose weight and they get leaner, so they have very few NKT cells originally. When they get leaner, they have a lot more of NKT cells. So it seems to be the case that somehow the number of NKT cells in the blood correlates with the weight, both in mice and in humans. So somehow this is telling us that NKT cells seem to be somehow protective against the development of obesity. And just one last thing. So there but they suggest a role for NKT cells in tumor immunity. And this, depending on the model of tumor used, it can be the case, so it has been described that NKT cells can have both positive and negative effects in tumor immunity. So this, for example, they have been suggested to enhance tumor immunity, and they will do so by increasing dendritic cell maturation, by production of cytokines activating both CD4 and CD8 and as well NK cells, and all these will function to kind of block tumor development. In some of the models, it has been suggested that it could be deleterious, and in this case it has been shown that actually, particularly for type 2 NKT cells, that they seem to block activation of other cells, and they seem to activate these myeloid-derived suppressor cells. So these guys are basically blocking immune responses. So in this case, NKT cells will be deleterious, so this will favor the growth of the tumors. So it's not obvious how this works, and it probably will work different depending on the type of tumor, depending on the stage of the tumor development. I think there is still a lot more that we need to do about this. I try to use NKT cells in the clinic. I try to use them for therapy. So basically, there are several different approaches that can be used, and for instance, is increasing NKT cell activation that can function. So just a couple of examples of things that have been used in the clinic or are being trialed. So one of them will be, as I said, the use of NKT cells in vaccination. And the idea of this would be to use it in some cases in which maybe T-cell vaccines don't necessarily work or they don't work as well. And this is the reason why I had this before. Okay. So you know that normally to generate vaccination, what you want is to generate, if you vaccinate someone, you want to generate a lot of antibodies. So these antibodies will then be able to eliminate, if you get infected again with a bacteria or a virus, can eliminate this pathogen. So how this normally works is you have your B cells, and the B cells recognize this antigen through their BCR, and then the B cells need help from T cells to produce antibodies. What is known is that if this antigen is a lipid, NKT cells can help B cells, and these B cells can produce antibodies. So the idea is, what has been suggested is that this could be used to actually generate specific antibodies in cases that T cells wouldn't necessarily work. And how this has been trialed, for instance, with Streptococcus pneumonia, because it has a lot of a very thick layer of polysaccharides, so T cells wouldn't necessarily be able to recognize that. So what the authors did here is to bind these polysaccharides with lipids, basically with our alpha-gal CER, and use this to immunize. So what will happen here is, as we said before, if we have NKT cells that recognize the lipid, the B cell will internalize the sugar and lipid, and then the NKT cells will recognize this lipid and help the B cells to produce antibody.